Hello everyone. So I'm back with another 7 marker question from conservative dentistry, which is discuss in detail and justify materials used for the restoration of class 5 cavities. Restorative materials can be classified into aesthetic materials and non-aesthetic materials. Non-aesthetic materials are amalgam, gold foil and gold inlay. Gold foil and gold inlay are not widely used. Aesthetic materials are resin composite with dentin bonding system, resin composite with glass ionomer liner, which is called the sandwich technique, flowable resin composite, glass ionomer, resin modified glass ionomer, compomer, and porcelain inlay, which is again not widely used. The class 5 cavity designs for amalgam restorations. Amalgam restorations are indicated in cervical and root caries, in incipient smooth surface enamel caries which appear as a chalky white line on facial surface, contraindicated in aesthetically important areas. Advantages of amalgam restorations are that they are stronger, easier to place, less expensive, easily distinguished from the surrounding tooth structure, easier to finish and polish without damaging the adjacent surfaces. The disadvantages are that it looks metallic and unaesthetic, and the 90-degree surface margins and specific axial depths result in a less conservative preparation. Initial cavity preparation for amalgam restorations. The outline form for class 5 cavities is based on the location and size of the caries. Outline roughly resembles the shape of a bean or kidney. The cavity preparation is performed using a number 169L or 271 tapered Fisher burr. Entry is done with the burr head almost perpendicular to the long axis of the tooth, as you can see in the diagram. Initial axial depth is maintained at 0.5 millimeters within the dentino-enamel junction. Following this, the preparation is extended to include the entire carious defect. Care should be taken to ensure that all the external walls are perpendicular to the external tooth surface and thereby parallel to the enamel rods. This makes the walls divergent. Extend the preparation incisally, gingivally, mesially and distally till the surface margins are located on sound tooth structure. The axial wall is located in dentine and it is convex as it follows the contour of the facial surface. Of the final cavity preparation. As the first step in final cavity preparation stage, any remaining caries dentine is removed using a number 2 or number 4 round burr. Any old restorative material that is present may be retained if it is intact and the tooth is asymptomatic. Since the cavity preparation walls, that is the mesial, distal, gingival and incisal walls, diverge towards the facial aspect, proper retention form is necessary for class 5 amalgam cavities. Retention form is provided by placing retention grooves along the axio-incisal and axio-gingival line angles. This is done using a number 14 round burr. The groove is prepared 0.2 millimeters inside the dentino-enamel junction to a depth of 0.25 millimeters. The groove is placed more at the expense of the incisal and gingival walls so as to protect the pulp. In case of large class 5 cavities, retention curves can be prepared at the 4-point angles using a number 14 round burr. Finally, the preparation is cleaned using an air water spray. Here is a diagram of a completed class 5 cavity preparation for amalgam showing retention grooves in the axial wall. Next, talking about the class 5 cavity designs for direct filling gold restorations. There are four types of design. The Ferrier design, general shape of the cavity of such a design is trapezoidal. Then class 5 cavity preparation with a proximal panhandle extension. This cavity consists of two portions, that is a facial or a lingual part whose outline is exactly like the previous design, and a proximal part, parallelogram in shape, and as an extension from the various variations in class 5 cavity designs for direct filling gourd. First one shows the curved occlusal outline to display less gourd. Second one shows curved gingival outline when the gingival tissue is strong and adherent. Third one shows partial moon-shaped cavity preparation, that is the semilunar shape. Fourth one shows basic trapezoidal form with a unilateral step. Fifth one shows basic trapezoidal form with bilateral steps. Sixth one shows basic trapezoidal form with a unilateral mustache extension. Seventh one shows basic trapezoidal form with bilateral mustache extensions. And the last one shows class 5 cavity with penhandle extension. Kinds of class 5 cavity preparation for composite restorations are based on the extent of lesion. They can be indicated for large lesions or defects that extend onto the root surface, class 5 abrasion or erosion area, aberrant smooth surface pit fault with bilateral extension occlusally, with unilateral extension occlusally, the diagrams of which are given on the right side. See the tooth preparation for small or moderate lesions or defects that do not extend onto the root surface. Using composites, these lesions are restored very conservatively. No bud joints are required, no grooves are required for retention. The lesion is scooped out, divergent walls are okay, axial wall is not uniform in depth. Initial tooth prep is done using round diamond or carbide burr, eliminating the entire enamel lesion. Dentin extension is done only if necessary. It results in a slightly beveled enamel margin. Let's see the tooth preparation for large lesions or defects that actually extend onto the root surface. The initial tooth preparation is done with 90-degree cavo surface margins and axial wall depth of 0.75 millimeters. Then the remaining infected dentin is excavated, incisal enamel margin is beveled, and the gingival retention form is prepared. Restorative material is the flowable resin composite. However, it has a lot of disadvantages, like it has reduced filler particle loading, lower modulus of elasticity, higher polymerization shrinkage, higher coefficient of thermal expansion, and it has a lower fracture toughness relative to the traditional resin composites. The use of flowable resin composite as a liner has not been shown to improve the clinical performance. Last restorative material, which is the glass ionomer cement. It is indicated in notched cervical defects of idiopathic erosion or of abrasion origin. In cases of gingival recession which lead to caries, it is also anticheiroogenic and hence the material of choice for restoring root surface caries in patients with high caries activity and where aesthetics is not as critical. The preparation is similar to dental amalgam without the need for mechanical retention. Cavo surface bevels are not recommended here because GIC is a brittle material that requires bulk for strength. A 90-degree butt joint approximately 1 millimeter deep is a reasonable minimum thickness. Talking about the sandwich technique, first a layer of glass ionomer is placed which replaces the missing dentine, reduce leakage, improve the potential for tissue attachment, for subgingival restoration, and potentially increase the retention, over which a layer of resin composite is placed to enhance the aesthetics, increase color stability, improve marginal performance, provide a smoother surface, and increase abrasion resistance. Next is the compomer. It restores the teeth that have carious cervical lesions and non-carious cervical lesions. The advantage is that it has a lack of stickiness, which has brought them ready for acceptance in the marketplace. The disadvantage is that the marginal integrity of compomers has been worse than that of resin composites in long-term clinical trials. Thank you. If you like this video, please subscribe to my YouTube channel. Stay tuned for further videos.